Hi, I'm Bob Schrupp, physical therapist.
Brad Haney, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, today let's get right to it. We're going to talk about the top 3 treatments for a painful hip, an arthritic hip.
You bet.
We've done some of these exercises before as part of other videos, but we're going to put it all together in one. Got a friend that's complaining of a painful hip, so we're here to help, right?
You better believe it.
All right, first thing you're going to do when you have arthritis, the thing about arthritis, Brad, is it tends to flare up and it tends to calm down.
Sure.
It doesn't just flare up and then stay up there generally, unless
Right.
you're irritating it.
Right.
So the first thing you want to do, and a lot of you are not going to like to hear this, but we're trying to get it to calm down, so one of the best ways to calm it down is not put as much weight on it.
Right.
So if, let's say I have pain in my right hip. In order to take some of the weight off that right hip, one, you could use a walker, but two, the least intrusive method would be use a cane.
Right.
Can you still see me, Nate?
And you and I know, Bob, that we've had patients, when you say something about a cane, they are just not going to go there because they just feel it makes them look old. But boy, if it's going to take some pressure off that hip and create some, or reduce the pain.
Right, and it's not permanent. You have
Right.
to understand that. We're just having you do it until the inflammation calms down, until the pain calms down. And then you're a little bit shorter than I am.
Well, yeah, a little bit.
Yeah. But the thing about it is, it's not permanent. Okay, you're just going to do it for a little while until it calms down.
Right.
So you're going to use it on the opposite side, Brad. Do you want to just show how you would use it just real quick?
Right. If this is a painful hip, you do it in the opposite arm, and you're going to walk with it. When you take a step forward with that right leg, the cane goes with it. And almost always in the clinic, I have people, I just tell them use it in the opposite arm, and I say walk with it, and they automatically sequence properly, it seems to be.
Yeah, I try not to even give too many cues because
Yeah.
they seem like they pick it up real quick.
Yeah, if you give them cues, then it gets confusing. So just put it in the opposite arm and walk naturally. Make sure it's adjusted right, standing tall. The cane should be right at the crease right there. But yeah, it's a great way to decrease the pressure.
I have quite often found, Brad, that alone can calm things down.
Yep.
And also avoid steps, avoid hills. I mean, all those things are going to put more stress on the hip right now.
Sure.
Then they calm down. Okay, that's number 1. Number 2, Brad, is motion. We want to get some motion in the hip. You're going to find out arthritic joints with arthritis, like to have movement, especially if it's not too far along.
Right.
If it's really far along that you need a hip replacement, then the movement's going to probably make it worse.
Sure.
But generally, the more movement there is in a hip, and this is a hip joint on the pelvis, the more the synovial fluid is created, as one person called it, snowmobile fluid. But it's just a kind of a grease, right, Brad?
Right.
It helps.
The lubrication.
Lubrication. So the more movement you have, the better it's going to be off, the better off it's going to be.
Right.
So let's show some movements, Brad.
You better believe it.
Can you get out of the way?
Oh, yes, I can, Bob.
Okay, we got the Packer ball.
Oh, yeah.
It's good for one thing, a pillow.
Don't listen to him, Packer fans.
All right, exercise number 1, before you get out of the bed in the morning. This is for you, buddy Mike. I want you to start getting some movement in that hip. And so all you gotta do is roll your hips back and forth like this. You're also getting some motion in the back, which isn't bad for you
You
either.
better believe it. 2 for the price of 1.
Keep your shoulders down, and you can even stretch a little bit, can't you? Because this is range of motion and stretching you can add into
Right.
this. So, and if I'm going to stretch, what you can actually do is bring it over like this, and even bring the one leg over a little more and stretch it even the hip a little more.
Yep.
You can also go this direction, but I'm going to hit a wall. So, all right, that's one stretch. You can do one range of motion. The second one is I want you to put one leg down, and you're going to bring the other one up and stretch. Now, don't make these hurt. You go up to the pain, stop, and then back off again. All right, there's nothing to be gained by, ow, 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 ow. I mean, just go into the pain, come right back off. You know, good 3-second stretch. You don't need to stretch it that long. You can do longer stretches too, if it doesn't hurt.
You have to listen to your body, you know, if you get that sharp pain, you avoid it. But sometimes with repetition, each time it may get less.
It'll start getting more movement, less pain. All right, go to the other hip. Again, we're kind of stretching into extension here too, Brad, aren't we?
Yep, again, the stretch on both sides if you keep this leg down.
Okay, those are the 2 main stretches you can do. There's another one you can do. You can do a hip extensor stretch, but I'm just starting to get some movement
Keep
here.
it to the basics
Right.
now on this.
So the third thing we're gonna do then is, the stronger a hip is, the better off it's gonna be also. It's
Sure.
the more the muscles can stabilize the hip, the less pain there's gonna be. So we're gonna show just a couple strengthening exercises. Brad, you wanna show one with a chair?
You better believe it. I
I
gotta
like
find
his
the chair.
enthusiasm this morning. He's got really a lot of enthusiasm.
Well, Bob, you know, I ate my Wheaties this morning. Okay, so it's nice to have a chair or something to, you know, if you have a walker chair, something so you have a balance, a cupboard. And we're gonna work on strengthening that hip. And one direction that is a nice direction to go is out to the side like this, okay? And we're gonna do 10 to 15 of these. And be careful not to do this where you get your body like a teeter-totter, is that, Bob?
You actually kind of look like a penguin almost.
Yeah, anyway, we'll not be penguins, we will be therapists and doing good exercises, and you'll feel that muscle right up in here. And the next one I like to do is just go straight behind you. You're gonna do 10 of these, not like this, bending the knee. We don't wanna work the knee, we wanna work the hip. And again with this one, some way to cheat or compensate is to do this, and that's not what we wanna do. We wanna stay up tall and work those hip muscles right there. You're gonna feel that. 10 of those, and then you can turn sideways so your knee don't hit the chair, and just do this like a single leg march. And do 10 of those, and you get 3 directions of the hip, which is really encompasses, you know, 75% of the muscles in the hip. What do you say to that, Bob?
Looks good. You know, and just to give a couple of the finer points that we maybe didn't cover the first go around here. One, people complain about using a cane, Brad.
Sure.
But what's amazing to me is because they're having pain, a lot of them are walking like this.
Yeah.
And what do you think looks older, Brad? Walking like this, or walking with a cane and walking straight up and not having any limp? I mean,
I think you look old either way, Bob. No, seriously, when you start walking like that, it's really...
Right.
The cane,
exactly.
you know, the cane gives a person a sense of dignity and...
Right.
Yeah.
That's
so
right, like
don't-
an English gentleman.
Right, yeah, don't be afraid to use the cane.
All right, the other thing I was going to point out, with the movement, why you want to try to get more movement in the hip, if your hip is limited, and let's say you're only moving this much, do you want to come on in for this one, Nate?
Yeah, let's get a close-up.
Yeah.
Not of me, of the hip.
I bet you he wants it of you. I bet you do. But if it's just moving like this, what is going to happen, it's going to wear out in that little spot.
Sure.
But now if I spread the forces out, now the forces are spread out through the whole hip.
Yep.
And so it won't wear out as easy in, you know, in that one spot.
Sure.
So that's why you want to keep the hip stretched out. You don't want to have it just moving in that little range.
Right.
Okay, any other fine details you want to bring up, Brad?
Well, the only other thing I can think of, Bob, if you're 40 and over and you want more information like this for yourself or your parents, we are going to be offering this we do this on a weekly basis.
Oh, we do,
Bob.
yeah. We're always trying to put videos up, you know, almost a couple a week normally.
Yep.
So
So take care and subscribe.